Okay, hello again. Welcome to Emergency Medical Responder, Chapter 13, Environmental Emergencies. All right, folks, as an introduction to environmental emergencies, basically when a person is exposed to excess heat, and we're going to talk about heats first, the body's mechanisms for regulating temperature can be overwhelmed. And what happens, it results in heat cramps, heat exhaustion, and heat stroke. Exposure to cold environments may result in conditions such as frostbite or hypothermia, so we're going to talk about that, and also talk about unintentional exposure to water that can lead to submersion and drownings. All right, once again, get patient assessment for environmental emergencies. It's the same as everything else. Remember the 5 components. Read it with me. Scene size up, primary assessment, history taking, secondary assessment, and reassessment. Your approach to a patient who has signs and symptoms of environmental emergency should follow this patient assessment sequence. Remember, this is the core material that you've got to know to be a good first responder and to introduce yourself into the EMT program. All right, so review dispatch information to help you decide on the possibilities of the patient's problem. Whatever they give you, the information will give you some clues, whether this is heat or cold or drowning, those kind of things. Assess the scene, determine safety, and then perform your primary assessment. And as you perform it, try to form the impression of, or form a first impression of the patient's problem. Determine the patient's responsiveness. Introduce yourself, check the patient's ABCs, and you want to see if they're alert to person, place, time, and event. Acknowledge the patient's chief complaint and begin to form your impression on whether this person is what we like to deem as sick or not sick or stable or unstable. That all happens within that first impression. All right, so usually it's best to collect a medical history on a patient experiencing a medical problem before you perform the secondary assessment. This is in case they pass out or if their condition deteriorates, period. It's better to ask the questions first. The sample format of that of what we use that follows that we're going to talk about is what is necessary to gain the information. Sample. So S stands for signs and symptoms. Remember, a sign is just like a stop sign. It's anything that you see. Okay. And then the symptoms is anything that the patient tells you. Next, you're going to ask A in the sample history for allergies, okay? M for their medications that they take, whether it's over-the-counter or prescribed medicine or any kind of herbal extracts. And then pertinent past medical history. Is there medical history that's pertinent to their chief complaint? And then their last oral intake. And then finally, what were the events that were associated with or led up to the illness of injury? Okay, so the secondary patient assessment focuses on the areas related to the patient's current illness. The patient may not always be aware of all the various aspects of his or her problem, so you need to obtain the patient's vital signs. We're going to monitor the patient throughout the use of ongoing reassessment until the arrival. So that ongoing assessment is the very last key part of the assessment triangle there. All right, so heat cramps. All right, so heat cramps is involuntary spasms of the muscles. Okay, it often occurs after exercise, especially in hot weather. It's most commonly occur in the leg or the calf muscles of the leg. And also you could get abdominal cramps as well. So when abdominal cramps occur, it may appear that the patient is having an acute abdominal problem, but it's actually only heat cramps. Treatment for this, number one, move them into a cool place. Have the patient lie down or be in a comfortable position. If they can drink, if they're conscious, and they have a good gag reflex that's intact and they can swallow, give the patient water to drink. And if you have electrolyte-based water drinks, that's very good too. If the cramps do not disappear, or if the patient is young or old or has a chronic medical condition, arrange to have the patient transported. Heat exhaustion. So heat cramps is the first phase. Heat exhaustion is the next phase. Heat exhaustion occurs when a person is exposed to temperatures higher than 80 degrees Fahrenheit or 27 degrees centigrade. Usually it's in combination with high humidity. It can also occur as a result of vigorous exercise at lower temperatures. Signs and symptoms of heat exhaustion could include the following: profuse sweating, lightheadedness, dizziness, they may be nauseated. When you palpate their radial pulse, it could be a weak pulse. And then when you finally get around to taking their blood pressure may be low as well. Some of the predisposing factors, that stuff that may be existing, that may make them more susceptible to heat illnesses, the very young or old, any pre-existing medical conditions they may have. Also, certain medications that they take may dehydrate them, and also high ambient temperatures, period, and then high humidity. And people that just aren't used to the heat, or they don't follow simple guidelines like rehydration therapy. People go out in the heat and they don't think about drinking water. And then if they start drinking alcohol, it just takes more water out of their system, so that can really exacerbate this particular problem. All right, so treatment. Move the patient into a cooler place and treat him or her for shock. Unless the patient is unconscious, nauseated, or vomiting, give them fluids by mouth, especially if you have some electrolytes. Monitor their ABCs, and then arrange transport to a medical facility. Heat stroke. This is much more serious. This is the last phase. Heat stroke occurs when the body is subjected to more heat than it can handle, and the normal mechanisms for getting rid of the excess heat are overwhelmed. The patient's body temperature rises until it reaches a level at which the brain could be damaged. Without prompt proper treatment, a patient of heat stroke will die. Signs and symptoms: flushed, dry skin that feels hot to the touch. Unlike heat exhaustion, the skin is usually still moist. Heat stroke, it's usually dry, okay? The clothing may be still wet, but once you remove the clothing, you notice that the skin is absolutely dry and it's hot to the touch. The patient will be semi-conscious or unconscious at this point. The internal temperatures of the patients is as high as 104 degrees Fahrenheit or 40 degrees Celsius. Treatment for heat stroke. Number one, protect the patient's ABCs and get them out of the hot environment and in a cool place as quickly as possible. Remove all of the patient's clothes down to the underwear. Soak the patient with water. We've got to get water on them to begin to rapidly cool. Now, I'm not talking about ice water, folks. I'm talking about plain old tepid tap water. It's going to be just fine. It'll be perfectly cool enough. If the patient is conscious and not nauseated, administer small amounts of cool water and immediately arrange for rapid transport. All right, so looking at this table 13-1, it gives you a good comparison of heat exhaustion versus heat stroke. So be sure to look that over. That's table 13-1. This is slide 16 of 46. All right, so let's talk a little bit about cold type of emergencies. We're going to start with frostbite. It can result when exposed parts of the body are exposed to a cold environment. As you can see a blistery white looking, and they're swollen. You can see a large blister here on the thumb. These are evidence, pure evidence of frostbite. So you need to take a look at it and make sure these are all body parts that are susceptible to it: the face, the ears, the fingers, and the toes. All right, so depending on the temperatures and the wind velocity, frostbite can occur in a very short period. Increases in wind speed have the same effects as decreases in temperature. This particular chart is from NOAA. It's about a wind chill chart on how the winds can blow and the temperature and what it actually makes the temperature feel like. All right, so frostbite. The most susceptible people are those weakened by old age, medical conditions, and exhaustion. Superficial frostbite: the affected body part becomes numb and then turns a bright red kind of color. Eventually the area loses its color and changes to a pale white. There may be a loss of feeling and sensation to the injured area. Treatment is warming. Warming a superficial frostbitten area or part must be done quickly and carefully. Don't try to warm a frostbitten area by rubbing it with your hands or a blanket. That's just going to create, detrimental movement on the tissues themselves and cause the patient a lot of pain. Right, so treat the frostbitten patient for shock. Deep frostbite is the patient's skin will be white and kind of waxy in color. The skin may be firm or frozen. There may be swelling and blisters that may be present. If the skin has thawed, it may appear flushed with areas of purple and white, or it may be mottled and cyanotic. Basic treatment is follow scene size up, primary assessment and secondary assessment sequence, and gradually warm this area up. So deep frostbite, you need to remove the jewelry the the patient is wearing and cover the extremity with dry clothing or dry dressings because it's going to swell and it can cut off circulation. That's why we're going to need to remove the jewelry. Do not break any blisters that you find. Rub the injured area. Don't rub that. Okay. Don't break blisters. Don't rub the injured area. Don't apply heat or allow the patient to walk on an affected lower extremity. Provide prompt transport. Okay, we're not doing anything aggressive with this at all. Let the EMS system, work with it once they actually arrive. All right, so hypothermia. Hypothermia occurs when a person's body temperature drops below less than 95 degrees Fahrenheit or 35 degrees Celsius. In hypothermia, a person's body is not able to produce enough energy to keep the internal or the core, that's what we talk about, internal core body temperature at a satisfactory level. People with inadequate or wet clothing or those weakened by illnesses are most susceptible to hypothermia. Signs and symptoms, feeling of cold and shivering, decreased levels of consciousness, sleepiness, lack of coordination, mental confusion, slowed reaction, and then ultimately unconsciousness. All right, so table 13-2, characteristics of systematic hypothermia. We're talking about core temperatures. Core temperatures are measured by rectal temperatures. You can get close to the core if you take it underneath the armpit, but these are core temperatures relative to rectal thermometer temperatures. So here's 93 to 95 degrees, what you're going to see, 89 to 92, 80 to 88, and then less than 80. As you can see, you drop below less than 80 degrees, which is really interesting because 80 degrees, everybody thinks, oh, that's warm. Not for your body. For your body, it could absolutely be deadly. So these are the progressive phases. When you first start to drop anywhere between 95 to 93, shivering and foot stamping, constricted vessels, rapid breathing, level of consciousness start to get withdrawn, and then it just goes downhill from there. So be aware of this chart, 13-2 or slide 25 of 46. All right, so treatment. What do we do for hypothermia? Well, first off, move them to a warm location. You got to get all of that wet clothing off of them. Get them in warm blankets and, over and under the patient because you want to be able to warm all surfaces. If the patient is conscious, give them warm fluids. There's nothing wrong with that. Give them something to drink. That way you're heating up the core, as they're drinking it. Just clear liquids, broth is not a bad thing. If they can tolerate that, chicken, beef, pork broth, whatever the case may be, or just hot tea. Tea is a good thing too. Just be careful not to give them caffeinated products because if you have decaffeinated tea, that's probably better than anything else, or coffee that's decaffeinated. If you do not have access to a building, move the patient to your heated vehicle or whatever. Find something where there's heat that's being put out of the vehicle, or wherever you can get them, where there's a heat source. Right, so if transport is delayed, you may need to use your own body heat to warm the patient until somebody gets there. Handle the patient gently. Hypothermic patients must be examined by a physician, period. If they get too cold, it can cause kidney failure, just general organ failure, all kinds of problems. So they need to be examined. All right, so cardiac arrest in hypothermia. If the patient's body temperature falls less than 83 degrees Fahrenheit or 28 degrees Celsius, the heart may stop and you will need to begin cardiopulmonary resuscitation. Always start CPR and use an automatic defibrillator if available on hypothermic patients, even if you believe they've been dead for several hours. Being cold actually preserves the brain and preserves tissue, so that might respond to warming up and then utilizing your CPR and your AED to try to resuscitate them. So hypothermic patients should never be considered dead until they have been warmed in an appropriate medical facility. Right, so drowning and submersion. Each year in the United States, more than 3,000 people die from drowning. Drowning is the second leading cause of injury and death among children between the ages of 1 to 14 years of age. Alcohol consumption is a contributing factor in many cases of drowning in teenagers and adults. Drowning is defined as a suffocation because of submersion in the water or other fluids. Submersion injuries also result from being beneath the surface of water or another liquid. Likely locations of drownings include streams, lakes, swimming pools, and hot tubs. Also, wading pools, public fountains, storm drain ponds, the beach, those kind of things. The following hazards are also hazards for drowning of infants and young children that are present in just about every household. Bathtubs, toilets, mop buckets. Young children can drown in liquids as shallow as 6 inches. 6 inches, folks. All right, so the stages of drowning. The process of drowning progresses through several stages. Usually the initial stage is panic as the person realizes that something is wrong. In other instances, the person becomes fatigued, injured, cold, or entangled in seaweed or kelp. Then they experience a loss of orientation. They become ill because of this, and then they begin a feeling of panic that produces inefficient breathing patterns. If a swimmer is not able to take in full breaths, buoyancy is lost and exhaustion sets in. Small quantities of water reaching the larynx causes spasms of the larynx, which are also called laryngeal spasms, which makes it hard or impossible to breathe. If this cycle of panic is not corrected, respiratory and cardiac arrest can result. Signs and symptoms of submersion injury include coughing, vomiting, difficulty breathing, respiratory arrest, cardiac arrest. They may even have broken bones or spinal injuries if there was a diving event that preceded their drowning, and then also hypothermia. All right, so treatment of submersion injuries. Well, scene safety is number one. You got to assess it. If the patient's still in the water, do not exceed the limits of your training in trying to rescue this person. You do not need to drown yourself to try to save somebody. So you need to make sure to call for additional help and get whatever proper equipment is needed in place to do the rescue, okay? And if there's evidence of trauma, you need to move the patient in a method that will protect the spine. And then perform your primary assessment. And in your primary assessment for the unconscious patient, remember you check for a pulse and scan the body for breathing. If there is no pulse, you're going to do your compressions, your 30 compressions. Then you open the airway, see if they breathe, and if they don't breathe, you give them 2 breaths, okay? Now, with drowning patients, if you remember back in your professional rescue or CPR, it talked about giving 5 rescue breaths before you get started with anything. So let's remember that. Those 5 rescue breaths, because the patient primarily needs oxygen. They have been without oxygen. So before you start that CAB process, go ahead and open the airway, clear the airway, make sure there's no obstructions in there, and give them 5 mouth-to-mask rescue breaths. Okay? All right, so let's just clarify that, make sure you know. Perfect. All right, so perform secondary assessment to check for any other injuries, correct for any airway, breathing, and circulation problems. Begin CPR as indicated. If the patient is breathing adequately, you want to administer high flow oxygen. And as soon as the ABCs are stabilized, dry the patient so they don't get hypothermic. And then cover the patient with towels or a blanket to help preserve body temperature. And obtain patient's medical history from the patient if possible, or from family members that are present. And then perform regular reassessments, once every 5 minutes at least, until you're relieved by EMS professionals. All patients who have sustained a submersion injury should be examined by a physician. Cold water drowning. You should always begin CPR on a drowning victim as long as the patient does not exhibit the definitive signs of death. When a person is submerged in cold water, a protective mechanism called the mammalian diving reflex may be activated. This reflex slows the heart rate and the metabolic rate and decreases the body's demand for oxygen. Therefore, when you encounter a person who has been submerged in cold water, even for an extended period, CPR should be started and continued until the person has been delivered to an appropriate medical facility. Lightning injuries, boy, I don't know where you're living at taking this particular program, but we're here in Florida and we're the lightning capital of the world. Oh my goodness. So lightning injuries, the electrical injury resulting from a lightning strike can cause cardiac irregularities or even cardiac arrest. Treat patients who have been struck by lightning by supporting the airway, breathing, and circulation. Oxygen administration, defibrillation, and CPR may be needed for some patients. Patients must be transported to an appropriate medical facility. Lightning injuries can cause electrical burns as well, so don't forget we could have some very severe burns. This type of burn is mainly internal, so the burns are inside. It's kind of like cooking a hot dog in the microwave. It cooks the inside of it. So the extent of the burn damage on the outside is not going to be visible immediately after the injury occurs. You may see an entrance wound and an exit wound, but everything from that entrance wound to the exit wound is all burned in between. All right, so bites and stings. Bites and stings are sometimes classified as environmental injuries or discussed under the topic of poisoning. In this book, they are discussed in Chapter 11, Poisoning and Substance Abuse. All right, so summary. Heat cramps are caused by electrolyte imbalance and dehydration. You should approach a patient who has experienced an environmental emergency and should follow the patient's sequence, okay? A person experiencing heat exhaustion sweats profusely, becomes lightheaded and dizzy. So you have your cramps first, then exhaustion. So the person with exhaustion may also have cramping, but they're also going to be sweating profusely, and they're going to become lightheaded and dizzy and nauseated. And also remember, predisposing factors may make some people more susceptible to heat-related illnesses. All right, so heat stroke, that's after heat exhaustion. So we have heat cramps, okay, heat exhaustion, and then heat stroke. Heat stroke results when a person has been in a hot environment for too long a period, overwhelming the body's sweating mechanisms. The patient's body temperature rises until it reaches a level in which brain damage could occur. The body parts, and then talking about frostbite, the body parts in summary are susceptible to frostbite are face, ears, fingers, and toes. Warming the frostbitten part must be done quickly and carefully, okay? Not rubbing, but just generalized warming. All right, then we talked about hypothermia. Hypothermia occurs when a person's body is not able to produce enough heat to keep up the internal core body temperature at a satisfactory level. And hypothermic patients should never be considered dead until they have been warmed at an appropriate medical facility. So we're going to perform CPR on them just like we would everybody else and defibrillate them and everything else. It's very, very important to remember. I do want to go back and remind you that the initial signs, coming back to here in hypothermia, the initial signs of hypothermia include a feeling of cold, shivering, decreased level of consciousness, and sleepiness. Signs of increasing hypothermia include the lack of coordination, mental confusion, and then slowed reactions. All right, and then finally, last summary 404, drowning can occur in a variety of settings, okay? At home, outdoors, signs and symptoms of submergent injury include coughing, vomiting, difficulty breathing, respiratory arrest, and cardiac arrest, and then even potentially trauma. And then we spoke about lightning. Lightning injuries are caused by a powerful jolt of electrical current that passes through part of the body. They may cause irregular heart rhythms or cardiac arrest. They can also cause electrical type of burns that causes damage within inside of the tissues, within inside of the body, and all those tissues that it comes from the entry wound to the exit wound. All right, folks. Assessment time. Remember, go back to your dashboard, go to the assessment block and do the assessment for this chapter and submit it. Take it a bunch of times, learn it, make sure that you know it, and that you got to get 70% or higher as a cumulative score for each chapter. All right, folks, it's been another good time with you. Thank you very much for your participation. Remember, if you have questions, email your instructor. Okay, please do. We love to have feedback back and forth with you. So just send us something by student@emets.net, and we'll get back with you as soon as possible. All right, have a good one. We'll see you next time.